I am Elise Dane Valde from BSN2I, and here I am today to discuss to you all about nursing informatics in Laos. So sit back, relax, and enjoy. Our objectives for this report is to have a background with their Democratic Republic, talking about healthcare programs for different income groups in Laos, healthcare market, the national healthcare system, three-tiered system, history of healthcare informatics, and the current aspect of healthcare informatics. During the last decade, a number of healthcare system research projects have been conducted in order to meet these needs in the Laos population. Poverty serves as one of the most cause of poor health in Laos population. In 2019, Laos had a population of 7,169,455, and the country is characterized by its subsistence in agriculture and remains predominantly rural with agricultural accounting. According to the WHO, between 1997 and 2015, Laos' poverty rate declined from 40% to 23%. Hospitals are highly dependent on users' fee for recurrent expenditures. In this time frame, the average life expectancy increased from 57 to 67 years old. The Lao People's Democratic Republic achieves the Millennium Development Goal or MDG target of reducing its maternal mortality ratio by more than 75% and the national government target on reducing child's mortality. The reported vaccination coverage has continued to improve and a wide range of vaccines are available through the government and donor support. The Laotian government currently has separate healthcare programs for different income groups. The following: State Authority for Social Security, these are for civil servants; Social Security Office, for employees of state and private enterprises; Community-Based Health Insurance, for informal sector workers. We also have Health Equity Funds for the poor and free maternal child health services. The Ministry of Health aims to achieve universal health coverage by 2025, and insurance program only covers 20% of the total population. For the healthcare market, in 2015, total healthcare spending in Laos was $220 million and is predicted to rise as the economy grows. However, Laos will likely remain a small market due to its small population. Currently, there is a need for cheaper value medical products such as refurbished medical equipments and low-cost pharmaceuticals. Over the past several years, the Laotian government articulated its commitment to expanding and improving its primary healthcare system. Therefore, public health services are now provided through a three-tiered system. For the first system, we have the central level. The MOH is committed to further strengthening the national MHIS. The health sector requires a system that can provide timely and accurate data for evidence-based policy and decision-making. The following goals are to rationalize and integrate district and provincial data where appropriate into one national health information system, develop the collection of vital data, improve the quality of management of data, and effectively use the data for monitoring and evaluation of the progress of health sector reform. The second system is the provincial level, where services are coordinated by the Provincial Health Office. Service provision through provincial hospitals and supervising supporting activities of the district health system. The last system is the dispensary level, and approximately 700 dispensaries serves villages throughout Laos, provided through an informal network that includes private drug sellers, village health volunteers, traditional healers, and traditional birth attendants. These are the priority programs of the 7th and 8th National Health Sector Development Plan. Since the late 1980s, Laotian citizens did not receive high-quality healthcare service, nor did they have access to adequate facilities. Therefore, a significant number of citizens traveled to Thailand for treatment of serious illness. During this time, the number of private health providers started increasing, and in much the same way, 25 private pharmacies have opened to meet the demand for medication that could not be obtained through the state health system. The gap in primary healthcare services between rural regions and cities has been decreasing noticeable. Building on this achievement, healthcare organizations starting applying IT in their services in order to improve the quality of healthcare delivery and keep pace with the patient's demand in the developing trend of the healthcare industry in Southeast Asia. In 2005, approximately 18 provinces were scheduled to have a completed program of national information infrastructure based on optical fiber technology. The Vientiane Gigabit Network attempted to develop and deploy the National Health Network application. This application provides a basis for patients' records, exchange of records between hospitals, telemedicine application providing advice at the district hospital for provincial or central hospitals, and contact with the drug control department, among other services. For the current aspect of healthcare informatics in Laos, the formation of Pan-Asia Networking last March 2003 held an all-partners conference in Vientiane, Laos. This conference reflected a shift from connectivity to application and concentrated on the development of application for distance education, rural connectivity, local language, telehealth, and e-commerce. Different doctors finally started to train with the IT, and in relation with this, some Laotian graduates have used internet regularly for research purposes regarding pediatric cases and formatting diagnosis, evaluation, and most importantly, treatment. Another healthcare strategy was promulgated by the Seventh Party Congress, includes full healthcare service coverage and healthcare service equity, demand-based healthcare service, self-reliant health service, and lastly, development of early integrated healthcare services. In addition to the nursing informatics in Laos, we also have the Faculty of Medical Technology. Under the University of Health Science, the goal of this project is to educate others on medical technology and its practice and application. The project plan was to improve the capacity of medical doctors through the Lao PDR on rehabilitation medicine, training for 10 doctors who can become a focal person on one rehabilitation medicine in each of their hospitals, and begin the process of restructuring the rehabilitation medicine system within the hospital. So that would be all. I hope you guys understand something about our topic for today. So once again, I am Elise Dane Valde, and I am reporting for the Nursing Informatics in Laos. Thank you.